There's this incredible paradox that when we stop running away, trying to escape, and drugs and alcohol and Netflix and romance novels and you name it, to sort of not feel our pain, when we actually then stop and turn and face that pain of our lives, whatever it may be, we imagine that we will be annihilated, but something really incredible happens in that moment, and we experience relief from our suffering. And I just find that absolutely fascinating.
Hello, Dr. Anna Lembke. It's a real thrill to be speaking to you today. As you know, the Examined Life podcast explores a question that a key thinker such as yourself thinks we should be asking ourselves. Now, you've done a huge amount of work in psychiatry, the psychiatry of addiction, and I wonder, from your learning, from your experience and expertise, is there a question that you think we should be asking ourselves?
I guess I would say I think one of the most pressing questions for modern humans, because I think we all ask the same questions again and again through the generations, but we have to reformulate them for our times, and different questions become more urgent at different times. As you can see, I'm prevaricating, trying not to get to the point where I actually have to pose the question. All right, but I think one of the most important questions, or a question that we could and should ask ourselves, is how is it that we as modern humans should be orienting on pain and pleasure? So what role do pain and pleasure have in our lives today, and how can understanding how we process pain and pleasure inform better choices?
One excellent question. How is it that pain and pleasure kind of affect the way we live today? You mentioned that this is relevant to modern life, which is presumably a slightly different or maybe drastically different from the way it has been in the past. So, how do you think, if you can speak in kind of general terms, we're orienting towards pain and pleasure in contemporary life compared to the past?
Well, I think, as you point out, implicit in my question is the idea that somehow the world is fundamentally different today than it has been for the most of human history. So let's talk about that first, because I think that's an important way to set the stage. And importantly, for most of human existence, we have lived in a world of scarcity and ever-present danger. And our reflexive, innate evolutionary wiring to reflexively approach pleasure and avoid pain is what has allowed us to survive over the millennia. But through scientific and technological innovation in all aspects of life, we have really transformed the world from a place of scarcity to a place of overwhelming abundance. And in this world of overwhelming abundance, we need to now orient differently on how we approach pleasure and pain. And namely, I believe that we need to embrace a new kind of asceticism, and we need to actively invite the friction of pain and suffering into our lives as a way to just generally be physiologically healthier, but also to strive for the kind of contentment and serenity that I think all humans are wired to want and to strive for. So I think that this is a unique time where we have to think differently about our orientation to pleasure and pain. And specifically, we have to go against our biology. We have to kind of actively and intentionally oppose millions of years of evolution if we want to survive, frankly.
So perhaps we could begin by unpacking what happens with pain and pleasure in the brain. Your work is based on neurotransmitters of pain and pleasure and what that is doing to us, because it's counterintuitive, isn't it, to avoid pleasure? It's not in our wiring.
I'm overwhelming my neurological system with these high dopamine rewards. And in order to compensate for that, my brain essentially has to continue to downregulate dopamine transmission as a way to restore homeostasis. You might imagine that as the gremlins multiplying. getting bigger and stronger. Eventually, I've got enough gremlins on the pain side of my balance to fill this whole room. They've got their tents and barbecues in tow. Now they're camped out there. And essentially, what that means is that I've changed my hedonic or my joy set point. Now I'm walking around with a pleasure pain balance semi permanently tilted to the side of pain. That means now I need more of my drug in larger quantities and more potent forms, not even to get high, but just to level the balance and feel normal. And when I'm not using my drug of choice, I'm experiencing the universal symptoms of withdrawal from any addictive substance, which are anxiety, irritability, restlessness, insomnia, dysphoria, and craving or intrusive thoughts of wanting to use. And how this resonates or is relevant on the meta level is that in the last 30 to 50 years, what we've seen is rising rates of anxiety, depression, and suicide all over the world, but especially in rich nations, which is really this paradox of plenty. Why is it that living in the richest countries in the world with the access to everything we could ever desire and then some, we are more miserable than ever? And I would argue it has to do with the mismatch between our ancient wiring and this modern ecosystem. We were not evolved for this world of plenty. We were evolved to be eternal strivers, never satisfied with what we have, always craving more. And this mismatch is leading to a kind of overwhelming population despair, essentially because from our first, potent cup of joe in the morning and checking our smartphones to our Netflix binge in the evening and everything in between, we're overwhelming our reward pathways and our brains are reeling in an effort to compensate.
You got on there to some of the more banal ways that we're addicted, like Netflix. And I guess that was my next question, because when people think about addiction, they think about people who have real problems with alcoholism or drugs or whatever. But you think this is significantly more widespread in the West and in ways that we wouldn't ordinarily call addiction. But you would like to use the word addiction here.
Yes. Yeah. Thank you for emphasizing the need for clarification there. When I say drugs, I'm not just talking about alcohol and cannabis and cocaine and heroin. I'm talking about really anything that releases a lot of dopamine in our brain's reward pathway quickly and in large amounts. And dopamine, is a neurotransmitter. It's not the only neurotransmitter involved in pleasure, reward, and motivation, but it is the final common pathway for all reinforcing drugs and behaviors. And the more dopamine that's released and the quicker it's released, the more likely that substance or behavior is to be addictive. And what I'm arguing is that every aspect of human life has become drugified in some way, made more reinforcing. It releases more dopamine, more accessible. One of the biggest risk factors for addiction is simple access to our drug. If you live in a neighborhood where drugs are sold on the street corner, you're more likely to use them and more likely to get addicted to them. Quantity. Can you imagine somebody who had access to cocaine at the level that we have access to TikTok? That would be a very serious cocaine problem indeed, right? And then we talk about a potency. We have engineered ancient drugs like opioids to be, 100 times more potent than opium from the poppy plant. That is to say, fentanyl. And we've also created drugs that didn't exist before. Video games, social media is in essence the drugification of human connection. We've got online pornography. Pornography and sex addiction probably always existed in some form, but it's the access, quantity, and potency made possible by the internet that completely changes the risk vulnerability diathesis, so that now you've got people who were innately vulnerable to addiction who are absolutely reeling. And then you've got a whole bunch of people who maybe aren't innately that vulnerable to the problem 200 years ago, but become vulnerable in the modern ecosystem because the drugs are more potent. And again, because we now have access to more drugs, including, again, drugs that didn't exist before. And I'll use myself as a case example. So I thought that I was immune to the problem of addiction. When I drink alcohol, I feel nothing but a headache. When I drink caffeine, it unfortunately does not wake me up. I've tried many different times and versions. So I thought, well, whatever this, addiction gene is, I guess I don't have it. But then, in my early 40s, I discovered romance novels. For whatever reason, I'd never read them before. I'd always been a reader, but never happened on romance novels. And I was absolutely transported. And then I got a Kindle, which is part of the technology making that drug more accessible. And I was off and running. I became a chain reader of, my Twilight was my gateway drug. Then I, found other vampire romance novels. And then I went to the next level of like werewolf romance novels. And then, not long thereafter, that wasn't enough. And I was reading like Frank erotica. And I know I wasn't alone because there were a lot of other middle aged women who were clearly hooked on Twilight and ended up, at 50 Shades of Grey, which is essentially socially sanctioned pornography for women. But it was very interesting for me to not be able to observe the phenomenon as it was happening, which is exactly what my patients with addiction describe. It's an insidious process that we don't see happening as it's happening. That is to say, the process of becoming addicted. Um, and it wasn't until I had a kind of a moment where I had to relate my reading habits to another human being that it became like real for me, which is, of course, the therapeutic function of going to see, uh, a mental health professional and having to tell your story. All of a sudden, it's like, oh, wow, yeah, I really did that thing, which is not necessarily observable until we put it into words. Anyway, I went a little far afield of your question, but
No, I think you answered that really well. Particularly this point about those things we think of as innocuous that are socially acceptable and sanctioned, that there's also like very little friction between you and your drug of choice, be it a book, a Kindle, or whatever. Have you noticed in your clinical practice a rise in these kinds of problems that wouldn't classically fit into your drug addiction categories, but have misshapen lives because of the habits that have developed around them?
yes, and I think this is really an important point. It's not just my own experience, but it's what I've observed in the past 20 years as a psychiatrist. And just to clarify, addiction is the continued compulsive use of a substance or behavior despite harm to self and or others. So what we're talking about here is a kind of engagement that leads to real harm. And what I have seen in just really ever growing volume in the past 20 years, but especially in the past 10 years, is alarming numbers of people coming in with severe pornography and sex addiction, mostly occurring on the internet. Um, and we're talking devastating, life threatening behaviors, people who are suicidal, who can't do anything else, who have lost their families, lost their incomes, or engaging in illegal activity. Young people addicted to video games, people addicted to social media or just the internet in general, getting caught up, in the spiral of being on their screens and then letting everything else go, their self-care, their obligations to others, uh, you know, reaching a kind of lethargy and nihilism, and again, uh, thoughts of suicide. So these are really, really devastating patterns of behavior, which are similar enough across different, demographics and ethnic groups that they really can't be ignored. Psychiatry is phenomenology. We base it on observed patterns of behavior, and this is clearly, an emerging problem. The other thing that I would add is that, um, we have many patients who come to see us who are coming in for depression and anxiety, insomnia, and attention, who don't self identify addiction to these behaviors, especially on the internet and screens and tech addiction, as causing or playing into their depression and anxiety. But when we engage them in asking them to abstain from their tech behavior for a period of time, usually on average about 4 weeks, what we find is that they initially feel more depressed and anxious, but by the fourth week, they're feeling less depressed and anxious than they have in many years. And I say that because there's a big question of causality versus, is this correlation or causation? because there's lots of data now showing that people who spend more time on the internet are more likely to be depressed and anxious. Is it because they're depressed and anxious and they're going on the internet, or is it because they're on the internet and depressed and anxious? And I would really argue that it's the causal direction is we're on the internet, we're priming our reward pathways with these highly reinforcing drugs and behaviors. Our brains are trying to compensate by downregulating. We go into this dopamine deficit state, which is akin to depression. And I argue that that's the causal direction because when we ask our patients to abstain for 4 weeks, the vast majority feel much, much better after having not been on their devices. So I think that's really important to think about.
It's huge, isn't it? In thinking about it as a parent and also someone who works in schools, it's like this is a significant job and it doesn't feel like we've figured out how to do it at all. And not in the slightest, really. What you say reminds me slightly of Pinocchio, the Disney story. When he goes into this hedonistic island where he seeks pleasure and it turns out to be some kind of hell. It feels like a really clever way of playing out the fruits of seeking pleasure for its own sake. And so we have this kind of reward and motivation chemical called dopamine. But when that becomes the goal in itself, that feeling, it seems like it's a very quick route to mischief. And so I suppose one of the questions that I'm failing to ask here is if we shouldn't be seeking pleasure, which the world is screaming at us to pursue, what is the thing we should be pursuing beyond it? What is the self-talk here?
Yeah. So to me, it's a three-part approach. The first is first abstain, and that again is very difficult to do in the world that we live in now. These drugs literally chase us down with push notifications and other such technological advances. So it's very hard to do that. Um, and when we first do that, by definition, we will experience pain because there's the pain of withdrawal, but there's also the pain of having to tolerate, our own negative emotions without distracting ourselves or escaping from them through these titillating, behaviors and substances that are really everywhere we look. So and because the world is kind of chasing us down with these pleasures, we really need to engage in what I call self-binding strategies. This is where we create both literal and metacognitive barriers between ourselves and our drug of choice so that we can press the pause button between desire and consumption. And I talk about three general categories of self-binding: categorical, geographic, and chronological. So categorical is like we might tell ourselves, and this may be true, okay, I can't play League of Legends video game because it's just too addictive, but maybe it's okay for me to play some other video game, or I can't play with strangers, but maybe I can play with friends. Or food is often, I can't eat processed food and sugar, but I can eat other foods. So we kind of create these categories. Chronological self-binding is where we do a kind of use time as a way to create, again, these boundaries between ourselves and these drugs, which is absolutely necessary in the world today. We might say, okay, I'm only going to use my drug on special occasions, or I'm only going to use 2 days a week for 2 hours a day, or I'm only going to use after I finish my exam, or I'm going to use at the end of this 30-day dopamine fast, which is the initial intervention. And then geographic is just exactly what you would imagine, not having the drug in the house, right? Or not having the app on our phones, or maybe not even having a phone. So like I own a smartphone, but it's 99% of the time it's turned off in my backpack. And I don't use it for texting, and I don't give out the number. So that's a great barrier for me because I'm essentially not on the phone. I'm not giving and I'm not receiving through the phone. Obviously, I'm on the internet and I'm interacting in that space, but I do it from this relatively less portable laptop. So these are, people have to find out what works for them. So it's first abstain, and then it's use self binding to maintain, and then the third thing is seek out pain. And from a neuroscience point of view, this makes a lot of sense. That is to say, if you go back to this pleasure pain balance, those gremlins are essentially agnostic to whatever the initial stimulus is. So if we press on the pleasure side, they will try to rebalance by going on the pain side. But if we first intentionally press on the pain side, they will hop on the pleasure side as a way to restore homeostasis, and we will get our dopamine indirectly. And getting dopamine indirectly, for example, through exercise, ice cold water immersion, focused concentration, cleaning out our closet, prayer, meditation, things that are effortful, that are difficult to initiate, that are even physically painful, as long as they're not too physically painful. These are all things that will ultimately change our hedonic set point to the side of pleasure. And that's what we're looking for, right? We're looking for a healthy, resilient pleasure pain balance that responds to pleasure and pain. It's not a matter of eliminating all pain and pleasure in our lives. We wouldn't be human, but it's a matter of not overdoing it in one direction or another. And because we live in this dopamine overloaded world, we have to, with intention, actually seek out pain or a kind of ascetic practices so that we stay in balance. So this is for, and again, these are ideas that have been woven throughout theologic and philosophical texts since the beginning of time, but with a slight twist. So, for example, Buddha preached the middle way, right? Not asceticism, not indulgence, but somehow in the middle. But the problem is that in the modern world, the middle way is already tilted to the side of pleasure. So I think we have to, with intention, tilt ourselves to the side of pain in order to stay balanced and in the middle.
So actually, I found your writing on cold water immersion in Dopamine Nation fascinating. I've been into that for a while, but since reading that there's a 200% increase in dopamine, I've been much more religious about going into the sea or turning the shower cold. The payoff is really good. It's interesting that going towards pain, the things you mentioned, they're embodied. Exercise, cold water immersion, prayer, meditation, as opposed to uh, classic addiction where, porn, gaming, those kind of things, they're not embodied in the same way. In fact, they're kind of living vicariously embodied in some way. I think you make the point to that effect in your book. So I guess my question is, the part of the problem we have is that we're very, very sedentary, that we've departed from the ways of our ancestors and feeling like embodied human beings, and we're living vicariously for pleasure rather than having it as a payoff from the way that we live naturally. Does that make sense?
Yes, I agree with you. And I would even take it a little bit further. And I would say that first of all, we absolutely need and crave physical experiences. And in some ways, drugs actually do that for us. So, they give us a physical experience that otherwise we are not getting in our lives. And that's part of their appeal. Um, I would argue that sex addiction, because it's almost always associated with orgasm, is also a physical experience, in a vacuum of physical experiences. And so, again, very attractive, very appealing. And then the video games, you're right. There we have our avatars. They run, they jump, they fly, they do all these physical things while we're just sitting there. But the physicality of the video games is in large part their appeal because we are so disembodied. So there's a funny way in which these drugs sort of simulate, an embodied experience, but actually are this real disconnection between our lives, right, and our minds and our goals and our values, and then this physical experience that we're having. But I agree with you 100%. We are our bodies. I mean, this idea that we have there's some a capacity to be a person not in your body. I really don't buy that. Like we are our bodies, and our bodies are a huge part of our subjective experience in the world, and the way that we both ignore and mistreat our bodies because we have machines that do the work for us, because we have a supply chain that delivers everything we need. We're really suffering because of the disembodied nature of our lives.
I've heard your book described as science catching up with grandma. This lovely phrase used to describe the stuff that we know intuitively or from traditional wisdom or what our grandmother told us. And now you're uncovering the kind of science behind it.
Yeah.
One question I have is really about something that you mention passingly and now and again in the book about the role of spiritual or higher powers. At one point, you say, I believe in believing when you've urged somebody to get on their knees and pray when they're struggling with an addiction. And I guess my question is maybe slightly upstream of that. So, over the last few decades, as screens have proliferated and friction has been removed from all those ways we can find dopamine, and at the same time, we've lost a kind of meaning making narrative that religion offered. Would you say would it be too much to suggest that perhaps as we've lost the sense of meaning and purpose, pleasure has become the kind of purpose of things? I mean, would you make that association? Does that make sense as a question?
Well, those two things definitely go hand in hand. So, I mean, I think it's fair to say that, again, for most of human existence, people derive their meaning through the notion of being part of something larger than themselves and some deistic, some kind of God, right? And some kind of purpose and meaning, some mystery, the great mystery. And of course, what's happened with the Enlightenment and science and scientism, because science is at the end of the day a religion in itself. Um, we are really these disembodied, purposeless, things that are just sort of floating around on this rock in space, and none of it means anything. And so I think, with that comes a kind of a nihilism, on the order of, well, if it, none of it means anything, and there's no reason for my suffering, then who cares? Like, then, like, Dionysian, like, let's just try to, like, just live for today and feel pleasure. And I think also a big part of that, because many people don't really necessarily even reflect on in spiritual terms, especially in our increasingly secular world, there's just plain old capitalism, which is, really the driving economic system, even in so-called communist countries today. And capitalism is sort of this incredible invention which optimizes human striving and innovation, but the ultimate end of which is to turn us all into addicts. The ultimate capitalist member of society, not necessarily the dominant members, but the vast hordes, is the ultimate consumer, somebody who just feeds the machine by continuing to look for an optimal product, and then ultimately becomes the product themselves, as we talk about often now, with the way that these digital products are really engineered to keep us hooked in. So I think it's I think all of those things, all of those threads are related, like the secular nature of our lives, the sort of underpinnings of capitalism, a kind of a nihilism, that Nietzsche certainly predicted, and that has really come to pass. And I say that because I see that in a lot of young people who come from loving families of privilege, who have access to the best education, and who have friends, and you name it, they could really do almost anything. And yet there's this incredible sort of lassitude. They can barely get out of bed in the morning. They see no reason for doing anything. And so they lose themselves in video games or pornography or what have you.
So you've got these fantastic, really practical tips on self binding and so on, but you can't impose a spiritual narrative on people. But do they at the same time have to re enchant the world so that it doesn't seem nihilistic? And that you know that hedonism isn't there and isn't the guiding principle of life, like to move away from the utilitarian and towards something a bit more transcendent.
Oh, yes. I mean, I agree with that 100%. And that's been also very true in my own life. But it's really interesting in modern Western medicine, the probably the four-letter word is the three-letter word of God. So we're not supposed to talk about God and spirituality. It's crazy. Even in psychiatry, it's kind of a taboo subject. But I do. I mean, I really I encourage patients to talk about spirituality. I ask them, do they, they have a spiritual practice? Are they a person of faith? So I try to meet them where they are and explore those aspects of their lives with them and really encourage that. And the nice thing about being in the field of addiction medicine is that there's a long tradition of getting into recovery from addiction through spiritual transformation. So it is, let's say, a sort of area of medicine where maybe spirituality talk is still okay. But even then, I would say most physicians uh, are really afraid to go there. I had a colleague recently who said to me, "Oh, I had a patient who came in. He was in a lot of distress, and he asked me if maybe he should start going back to synagogue or seek out his rabbi." And she said, "And I'm Jewish, and I wanted to tell him, yes, you definitely should, but then I thought, no, I shouldn't do that because I'm a doctor." So
It's so interesting, isn't it? Lisa Miller, who I interviewed for this series, her research suggests that you are with spiritual practice something like 80% resilient against despair and suicide, and presumably addiction comes in there too. And yet, despite the evidence base, it's kind of taboo. Like in the UK, you could be struck off because it seems proselytizing to talk about spirituality. So it's interesting when we want to be scientific, and there's data here. There's something to be said.
yeah, that's right. That's right. And when you look at, for example, we have data showing that participation in 12-step groups like Alcoholics Anonymous, which is really founded on this idea of a spiritual transformation or higher power. When people participate in that, they have good outcomes that are on par with, let's say, seeing a psychologist, and maybe even better than seeing a psychologist for long-term recovery. And when you look at the mechanisms specifically that are at play in those organizations, the spiritual transformation or the higher power is an very important part of that. Yeah, and yet I think it's again I would argue that this is the age of scientism, and science is our new religion. And if you can't quantify it and you can't do a controlled trial or whatever, or even if there are controlled trials, people are very resistant to these ideas.
Like, I hope the conversation there is beginning to change. I mean, maybe it's just what I read, but there's a certain kind of disenchantment with scientism and reductionism and utilitarianism and instrumentalism, all these isms, these things that seem to be governing the way that we live in a really dissatisfying way. So if our pursuit of pleasure is part of the problem, how should we think about pleasure? Like, what role should it have in our lives?
Yeah, yeah. I mean, so my message is not never imbibe intoxicants, but my message is use them infrequently and in moderation, and try to avoid very potent forms. Um, once we reset our reward pathways, um, even very simple, modest rewards can be highly rewarding. In other words, this is like this is really, pain and pleasure are incredibly relative. And that's what we have to recognize. And that if we're always upping the ante and using, more and more of these reinforcing drugs and behaviors, ultimately, they all exhaust themselves. Nothing then is pleasurable. And then things that are more modestly rewarding that used to be pleasurable aren't pleasurable, either. So it's really a matter of keeping a healthy and resilient pleasure pain balance, and we need to do that by generally avoiding intoxicants and using them uh, in moderation when we do use them, and allowing enough time in between for those neuroadaptation gremlins to hop off of the pain side of the balance and for homeostasis to be restored. Because what we don't want to do is get into that situation where we're getting into the addicted brain, which is those gremlins camped out on the pain side of the balance. There's an interesting experiment done by George Koob, a neuroscientist, and his colleagues, showing that if you expose rats to an unlimited amount of cocaine, they will essentially accelerate their consumption by pressing a lever faster and faster over the course of subsequent days. But if you allow them to have access to cocaine only 1 hour a day, then the rate at which they press that lever stays steady over the course of many days. So there is something important about having enough time in between our usage to kind of restore this homeostatic set point so that we don't start chasing more and more dopamine. So I think that's really important. And then again, I do think it's really important to recognize the ways in which so many things have become drugified. Even watching a Netflix show, we might not think of that as a drug, but I challenge people to think about how they feel when they're watching a show and then how they feel right when the show ends. And then what it means that when you come to the end of an episode, for example, that there's a little button in the right hand corner that starts to go through and say next episode. And so you'll automatically be given that next episode unless you do the work to stop that button, which is, I think, a great metaphor for the world that we live in now. We have to actually, in advance, prepare for and do the work to avoid pleasure. Because otherwise, the world is set up to just keep that fire hose going. So I think that's really important. And then, inviting pain into our lives, doing things that are physically hard. We have a whole narrative that pain is bad for you, that pain is not just painful in the moment, but kind of creates a kind of psychic scar for pain in the future. That is completely different from how people used to think of pain, the role of pain in our lives. The people used to believe that, it was not only were there spiritual gifts through suffering, but even surgeons, in the mid 1800s, when general anesthesia was first invented, did not want to use it because they believed that their patients needed to experience pain during surgery in order to heal faster and have a better recovery. And that sounds like barbaric to modern people. And yet, fascinating studies are now showing that when surgeons spare opioids during surgery, that is to say, use fewer opioids or use no opioids, that patients heal faster from surgery. So there's real scientific evidence to support, that kind of sort of instinctual reaction that surgeons had to general anesthesia with opioids in the mid 1800s. So
You're talking about something much bigger than chemicals here, really. It's how we live, how we orient our lives. Something you say towards the end of your book is that you urge your reader to embrace yourself fully in the life that you've been given. I take it from this that the suggestion is that we run away from the life that we've been given and into the kinds of cul-de-sacs that pleasure offers. But perhaps you could explain a bit more about what the intention behind this kind of challenge was to us as readers.
the way that it comes to me visually, that we most of us spend most of our lives literally, like not literally, like figuratively, mentally running away from the pain in our lives, whatever it may be. And that is a race we will never ever win. uh, at some point we will be too exhausted to keep going, and the terror of that moment, we can't even fathom it. And yet there's this incredible paradox that when we stop running away trying to escape in drugs and alcohol and Netflix and romance novels and you name it, to sort of not feel our pain, when we actually then stop and turn and face that pain of our lives, whatever it may be, we imagine that we will be annihilated, but something really incredible happens in that moment, and we experience relief from our suffering. And I just find that absolutely fascinating. And I would say, as a psychiatrist in the work that I do, um, it's really changed the way that I talk with patients, because early in my career, because of where I was in my own life and still running from pain, and also the way that I was taught to prescribe pills for people to make them not feel pain. And if I was going to be a good doctor, then I would get them out of their pain. And now I don't orient that way at all toward patients. Instead, I see their suffering as part of our communal suffering. I try to some extent to normalize it, to validate it, to just kind of bear witness, and to also trust in their own ability to tolerate it and to endure and to keep going, which is a very different thing than saying, "Oh no, you're depressed. Here, let's give you some pills and take that away." And are you less depressed now? No. Okay, so here's some more pills. And um, the other way that this idea, this different way of orienting on pain has really affected my practice, which is at serious odds with the way that mental health care is delivered today, is this the way that people now orient on trauma. So there's this very, I would say, like overwhelming movement now in mental health treatment that if we're unhappy or have dysfunction in our lives, that what we need to do is go back into our past and find that moment or two or 10 of how we were traumatized, typically by other people who then get identified as the perpetrators of our suffering. And then once we've done that, we will be completely illuminated as to why we're so unhappy, and then that will solve our unhappiness. And first of all, I don't know that that is true. So that's the ancient Freudian idea, that that adult psychopathology can be is caused by these early childhood experiences that then often enter some unconscious realm, and maybe we don't even remember them. And once we bring them to the surface, then we'll solve our psychological problems. And I mean, the longer I practice psychiatry, the less true I think that is. I think that we're much more likely to be influenced by things like temperament, the people that we surround ourselves with, the ecosystem and the culture that we live in, the dominant narratives. But we nonetheless tell ourselves, and mental health care providers encourage this telling of a story where you identify that moment of trauma. And what happens to those people often is it doesn't help them, it doesn't move them into wellness or serenity or a better way of living. It instead makes them feel like the perpetual victims. They perseverate on their trauma. They often then disconnect from the supposed perpetrator of the trauma. So this idea that like the difficult things in our lives make us weaker is really, I think, really problematic.
That's really interesting. I've not heard much pushback against that before. It's dominant, this idea of finding the pain in your childhood and bringing it to the fore, and then you're going to have dealt with it in that way. One last thing I'd like to ask you about is truth and deception, which have some place in this whole story of addiction. Like, what we do on screens is essentially secret. We can get away with things when we live in atomized communities. We're far less relational than we were. I think made to be. You have this observation that truth produces a sense of plenty or abundance, a kind of spaciousness, whereas deception or lies create scarcity. I think I paraphrased it badly there. Would you mind explaining the gist of it?
Yeah. So I think a good way to enter into this is to talk about the Stanford marshmallow experiment. So this was an experiment that was done many years ago where they put a child between the age of 4 and 6 in a room with nothing else in the room except for a table, a chair, a plate, and one marshmallow on the plate. And they said to the child, if you can wait 15 minutes here in this room by yourself without eating the marshmallow, we will give you a second marshmallow and then you can have both of them. And it was a way to kind of measure the ability to delay gratification. And what they found was that it highly correlated with age. The older the child, the more able they were to not eat the marshmallow in order to get a second one 15 minutes later. And then the sort of the part of the Stanford marshmallow experiment that became very famous is that they then followed these children prospectively to show that the kids who could wait longer at a given age compared to the kids at the same age who couldn't wait as long, The kids who could wait longer went on to college, had better jobs, had better test scores, more successful lives. But a little known variant to that experiment was where they divided the kids into two groups. Into one group, they said, now the same thing, you wait 15 minutes, you'll get a second marshmallow. But you see this bell here? If you ring this bell anywhere in those 15 minutes, the researcher will come back. So if for any reason you want to, ring the bell and have the researcher come back, they'll do that. And what they did is that in half of that cohort, when the child rang the bell, the researcher indeed came back. And in the other half, when the child rang the bell, the researcher did not come back. In other words, the researcher had lied to the child and said, I'll be there for you. But then they weren't. And what they found was that in the cohort of children who were lied to, they were much more likely to eat that marshmallow and not be able to wait the full 15 minutes. And as I interpret that, what I think that means is that when we live in a world where people tell the truth to each other, then we have trust in an unseen future, and we feel we can rely on the world being an orderly and predictable place where people will do what they said they would do. And when that happens, then we can delay gratification because we can trust in other people and trust in the world. And that is a plenty mindset, as opposed to a scarcity mindset where people lie to us. We can't rely on them. So I better take all I can get and eat that marshmallow right now, because who knows, if they didn't come back at the bell, they're probably not going to give me a second marshmallow, even if I wait the full 15 minutes. And I think this has, to me, really interesting implications um, for the world that we live in now and for a conceptualization of addiction, because addiction really is the ultimate scarcity mindset, right? It's you've got a lot of your drug. You wouldn't be able to get addicted without having access to quite a bit of it, and yet you have this continual feeling that there's never enough, and you can't wait and you can't delay gratification. And there's lots of data and lots of studies showing that people who are addicted discount future rewards and opt for immediate rewards. And it's like it's like a very nice, it makes a very nice indifference curve when you examine that. But the other part of that, the sort of corollary to that, to me, that is fascinating, is that let's not start with the addiction piece that often also leads to lying. Let's just start with the lying. And we now live in a world, like a post-truth world, right, where people can make up their entire identities and run for office on fake identities, and then other people find out that it's fake and then still vote for them. I mean, it's like truth is sort of optional. And I think that that very much contributes to this kind of addictive tendency, that we then all gather this sense of, well, the world is an unreliable place. I can't trust my politicians. I can't trust other people. So I'm just going to eat myself silly. So that's how I understand that.
That's a super helpful explanation. And particularly your interpretation of the marshmallow experiments is telling. I think of it the way I bring up my kids, because I can be late for things. I say I'll be a minute and I think it's innocuous, and actually it's not, you know?
Right. And I'm always very interested in how these ideas can practically influence our choices. And so I hope that anecdote and the explanation of it and encourage parents to be really truthful with their kids, to admit their mistakes, to show up when they said they were going to show up. It's all those little things, the accumulation of those little things, that absolutely hugely impact how people, perceive the world and the framework that they then apply to their choices. So I'm glad that you think about that vis-a-vis your children. I think that's really important. And I try not to lie to my children too. I'm often unsuccessful, but then I try to make amends.
So if I can just kind of do a brief review of what I think we've been talking about, and particularly what you've been saying.
Great. Thank you. That'll be good. I'm going to write it down.
Well, it's been fascinating to listen to you here talking about how society needs a reset. And that's absolutely clear. But we can't rely on the society we're currently living in to reset itself for our benefit, because that's not going to happen. It's too much enthralled to big tech or consumerism or whatever else. So, what needs to happen on an individual level and a family level is when you ask yourself this question of how do I orient myself towards pain and pleasure, is to step back and to think about how we need a reset in terms of what we are enthralled to and how this kind of misshapes the way we orient to the world and to those around us. And so, one of my big takeaways from your book and from this conversation is, what would it mean to have a healthy relationship with pain and pleasure?
Yes, that's wonderful. Yes, and that's a wonderful way to phrase it. I wish now I had phrased that way in the beginning. What would it mean to have a healthy relationship with pain and pleasure? And again, because I'm ultimately a very practical person, and I feel that life is one grand experiment that we're always tinkering with the variables. To me, the recipe for a healthy relationship with pain and pleasure is really this three-step recipe. First, abstain, then use self binding to maintain, then seek out pain. And because it rhymes, it will hopefully be easy to remember.
Rhyming is a wonderful way to work it into the memory. Dr. Lemke, it's been such a pleasure to speak to you, and I think your book is a massively important one that I frequently recommend.
Well, thank you. It's been really a pleasure. And thank you for your thoughtful questions and your curious mind. And also, thank you for teaching young people. I think that's a really important job.
I appreciate that, and thank you so much for your time today. It's been a privilege and a pleasure.
Oh, you're welcome. Thank you so much.